Hi everyone, so today I will be verbalizing a little bit about how to place a Foley catheter. So once that we are in the room with the patient and we perform hand washing and we use the two method of identification to check for the name and date of birth of the patient, we want to explain the procedure to the patient as well. We want to lower the bed to our comfortable or raise the bed to a comfortable position for us to work. We wanted to use a sterile set for catheterization, and we will have to make sure that everything is closed, that is proper to use within the normal expected period of time. We want to make sure that everything is properly equipped, and of course when we are performing the setup for the equipment, and we're in the bed with the patient, and we explain everything that's going to happen to the patient. This is more likely what is expecting for us to be seeing when we open the kit. So as we can see in this picture right here, we can see that we have tweezers, we can see that we have iodine, we can see that we have a syringe with a little amount of saline water, 10 milliliters most likely. We can see that we have sterile gloves. We can see as well that we have the tubing, and we can see as well that we have the bag, and also we have this right here is like a little bottle for us in case that we need to take any type of culture or something like that, and as well the gases for us to clean. So when we are doing a female or male, we have to make sure that we follow all the cleaning procedures. So in case of the female, we want to keep the area open, and supposedly already at this time we make sure that we have or still feel completely set up in the bed for us to properly start the procedure, as well as we follow the directions for placing the gloves, sterile procedure as well for the gloves for in this case. So this is where we're expecting to see in the case of the male. So this is already when it's on, and in the case of the female, we want to make sure that we place it in the urethra, which is this small little hole right here, knowing the vaginal opening. So in case for us to place it in the urethra, first of all, we have to clean the area with iodine. We have to follow proper assessment for the patient to ask in case of any allergies or something like that. For iodine, we want to do just one stroke on each side, and we want to keep the area open, right? We don't want to touch anything else. When we have one hand, the dominant hand that we are going to be using for all the equipment, we want to keep the other hand for the procedure, and with everything should be open in this case, the legs, and the patient has to make sure that she's not moving. And so as mentioned before, we want to place it here in the urethra, this the small little hole right here, right? And what we're gonna expect to be seeing is a small little tubing that is going to be inserted. So at this point, when we're going to be inserting, we want to make sure that that tip that is going to be inserted is going to be lubricated. Of course, we mentioned that we at this point already cleaned this area right here. Just one stroke from up to down, right? So it will be like this, front to back, I'm sorry. So both sides with iodine. So when we are inserting the catheter, we are expecting to fill with one of the sizes with a syringe. So this is what is going to be inside, right? And we're going to use one of these two tubings to fill it out with saline water with the syringe right here that we said that it was already pre-filled with 10 milliliters. Most likely. So we place it on one side, right? We fill it up, and this part right here is the one that is inside. So this is another clear picture for us to imagine how it will look inside. So in case of the male, how we know that it's in the same opening, like urinary opening that the male has. And it will be pretty much the same thing. Everything, we have to follow proper sterilization techniques for these. And the procedure of inserting the tube is through the urethra to the bladder to remove the urine, right? So right here, that's the bladder. So it will be that will be the inside part of the bladder. And this is the tubing that we mentioned that was has to be lubricated as well, right? And what we're gonna fill, one of the side of the syringe, what we're gonna fill with a little bit of saline water is this little balloon right here. So the balloon should be filled with water, and we can gently pull a little bit once that we're done filling it up to make sure that it's tight, right? That you don't want to pull like super strong. You just want to do like a gentle pulling thing to make sure that is properly filled and placed, right? So once it is like that, we want to secure this with one of the it's like a tape, right? And it will look kind of like this to secure the bag as well. That's for patients when they're walking through the hallway and stuff like that. We want to make sure that they're keeping their bag, or the one to drain the bag or something like that. They can keep it on one of the side of the leg. We usually, for men, we may have to ask her which side they hand. Usually they hand, so it's easier for us to place the catheter in the tubing inside, right? And it's comfortable for they when they're moving, and to avoid like kind of a friction. Also, when we are doing the indwelling catheter, we, like mentioned before, this is a sterile procedure, so we want to follow proper sterile techniques procedure for the hand gloves, for everything. Remember that nothing should be crossing on the sterile fluid when you have it set up. Always want to use as a guide the 1-inch margin border to opening the kit, to opening the gloves as well. The kit comes with an absorbent pad, right? We want to place the shiny part at the bottom and the absorbent pad like at the butt of the patient, right? So anything that comes out or whatever is gonna stay there, right? And it's gonna be easy for us to remove everything and put it in the biohazard bag once that we're done. And like mentioned, at this point, the patients should know what type of procedure we're going to be performing. Sometimes you may have someone that can help you out, a coworker that can help you out with that as well. And some patients may have really weak legs, and they may not be able to move like the lower part or something like that, and you may have one coworker to help you out to raise the patient. The patient should be in the supine position for better placement of the catheter. And in case the catheter size usually is 14 to 16, usually it's 14 to 15, the insertion is 2 to 3 inches. I'm sorry, the insertion is 2 to 3 inches. And like mentioned, you have to gently you pull a little bit, you pull a little bit, just like gentle pulling for you to confirm that it's placed in the right place. And that will be all. Thank you.